Observe my eye as a beam of light hits it. The light reflex starts with the light hitting the eye and the impulses being conducted to the optic chiasma through the optic nerve. From here, fibers of the optic tract carry impulses to the pretectal nucleus in the midbrain. The Edinger-Westphal nucleus of both sides receives impulses from the pretectal nucleus. Preganglionic fibers from the Edinger-Westphal nucleus relay in the ciliary ganglion, from where postganglionic fibers lead to the sphincter pupillae muscle and cause constriction of the pupil. Bilateral innervation at the Edinger-Westphal nucleus is responsible for the indirect or the consensual light reflex. Now, let's talk about the accommodation reflex. The accommodation reflex consists of constriction of the pupils, convergence of the eyeballs, and increase in the curvature of the anterior surface of the lens when the eye needs to focus on a near object. Observe the change when an object is held near the camera lens. This refocusing of the lens occurs in less than 1 second in the eye. The accommodation reflex is pretty similar to the light reflex. It starts off passing through the optic nerve, passes through the optic chiasma and the optic tract to reach the lateral geniculate body. From the lateral geniculate body, fibers pass to the visual cortex. Fibers from the visual cortex lead to the Edinger-Westphal nucleus. From the Edinger-Westphal nucleus, fibers follow the same pathway as the light reflex. Understand that the pretectal nucleus is not a part of the accommodation reflex. We will explain the clinical significance of this fact when we talk about the anomalies of these pathways.